Hello, everybody. Welcome to this presentation on labour and birth. I will be sharing a presentation with you shortly. I just wanted to say welcome, congratulations on your pregnancy, and well done on finding out about birth, finding out about labour. This webinar should be used as just an introduction, really, into what you need to know, what you need to learn, and we'll give you some really useful stuff. So without further ado, I will just go and find my share screen. So this is, as I say, a presentation on labour and birth. It's your overview, it's what you need to know, and it's a starting point for what you need to learn. So I'm Jilly, I'm the owner of CubCare Antenatal and Baby. I am an antenatal teacher, a hypnobirthing teacher, pregnancy yoga, and I teach baby classes as well. I've been teaching since 2014, so I've got a lot of knowledge and a lot of experience. And I'm also a baby wearing consultant since 2021. So I can help you find carriers, I can help you understand why it's so helpful and so important, and yeah, make sure it's the most comfortable it can be for both you and baby. I'm a mum of two. I'm experienced in birth. I've had myself a hospital birth and a standalone birth centre birth. I've been in theatre, I've had a medicalised birth, I've had a drug-free water birth. By no means experienced it all because I've only had two births, but I've had a lot of experience and a lot of knowledge about different types of birth. And I've breastfed, I've formula fed, I've mixed fed, I've bed shared, I've co-slept, I've sleep trained, I've done a lot in parenting. So there is no judgment from me. I strongly believe that the more prepared you are for birth, the medical system, the choices that you might face, the better. There is no such thing as too much information. You can't make the choices that are right for you unless you know what your choices are. So it's my aim to give you as much information as possible, and really help you to navigate your choices. The choices that you make will have an impact on certain things. We know that, research shows us that, but hopefully I'll be able to give you some knowledge of, you make that choice, so it means that might happen and this is what you can do to potentially help avoid it. Putting the power back in your hands is what is really important to me. So please use this session as a starting point for your antenatal education. You'll be learning what happens, what you can do for yourself, and what might be offered to you, but it is by no means a foolproof guide. And I'll talk to you a bit at the end about my courses, and you will see just why my courses are so long, because I need to and I want to give you absolutely everything. So we'll head straight into today's session. It's an introduction to antenatal education, and we're going to be focusing on labour and birth, and just give you a bit of an overview of what labour is, the different stages, what is happening, and why. So we'll be talking about the stages of labour, we'll be thinking about your uterus, your cervix, and we'll be helping you prepare for your birth. So first of all, it's really important to know that there are 3 stages of labour. For ease, they are called the first stage, the second stage, and the third stage. Within those, as you'll see in a second, there are different bits that are, particularly the first stage, it's broken down into several subsections. But as an overview, the first stage and your second stage is about birthing your baby. So the first stage is where your contractions start and your cervix dilates to around 10 centimeters. And your second stage is your pushing stage. So it's the actual birth of baby. So that is where your main focus needs to be when you think about preparing for birth. But you also have your third stage, which is after your baby's been born and until your placenta has been delivered. It's a time where that needs to happen. Your placenta is part of baby, it's part of your pregnancy, and it needs to be delivered alongside baby. But it's also a point where your baby is transitioning into the world. They're learning how to breathe, they're learning how to regulate their temperature, they're learning that suddenly things don't happen automatically anymore. They have to start doing things for themselves. So thinking about the first stage of labour, it is broken down into 3 sections itself. You've got the early phase of your labour, sometimes it's called the latent stage, and this tends to be the longest part of your journey. It's the part of your journey where you'll be feeling fairly normal for the most part, but it can be quite a long stage of your labour. You've then got your active part of your labour. This is the part where medically you are in labour. Before that, in your early labour, as we'll find out, it's not really classed as being in labour. It's only from the active stage sort of onwards. This tends to be around 6 to 20 hours. It can be shorter, it can be longer. And you've then got the transition part of your journey, and that's the end of your active labour. It's the bit that is in films and television, and the real dramatised bit of your birth. And it's where your body is preparing to birth your baby, to look after your baby. So there's often no obvious change from one point to another. It's more of a gradual change. Some people might experience a point in which they kind of remember, yeah, that's when it got serious and that's when it changed. But generally, it's more of a gradual thing. So it's much less obvious when you're moving from one stage to the next. So early labour, as I said already, it can be sometimes called the latent part of your labour. It is the longest part of your labour. So what is happening during this stage? Your cervix needs to go from fully closed to 4-5 centimeters dilated. Your cervix is changing, baby is getting ready, and your hormones are starting to build for the rest of your journey. Now, we will be thinking more about the cervix and what those arrows mean in a second on our next slide. So thinking about your cervix is a really important part of your labour, but I really think that we should be focusing more on what the uterus is doing, and we'll think about the uterus in the next slide or two. But they work together, and it's the uterus that is contracting in order to help change the cervix. So we like to think of the cervix being like the bottom of this funnel. So as you can see there with the hands and the baby in the hands, where the arrow is pointing to is the bottom, and the wrists, as it were, and that is where the cervix is. So if you look at this picture of the funnel, you will see that there is the cup sort of bit, and that is where baby is sitting. It's not open, it is fully enclosed. And then you have the bottom bit, the long bit of the funnel, where everything is kind of passed through. Now, unlike the funnel, the cervix is designed to change. It is designed to soften, to move, as you're nearing the point of birthing your baby. The job of the cervix in pregnancy is to keep everything in, keep stuff out, and keep baby safe. It is about 2.5 centimeters long. It's quite thick, quite cartilagey. It kind of feels like the tip of your nose. It's quite hard, and it's actually not pointing straight down where you might expect it to be. It's more, it's almost horizontal. It's kind of pointing towards your back. So if you kind of shift this funnel to the side, that is kind of where it is. As you are nearing the end of your pregnancy, hormones start to get involved. They start to change your cervix in order to prepare it to release baby. So it starts to soften, it starts to shorten, it starts to move forward. And those hormones and sometimes contractions are helping this to happen. Now, I think the focus should definitely be much more on the uterus, and rather than how much that cervix is changing, how much that cervix is opening. And I focus much more on the cervix in our full antenatal course. But just as an overview, that's what the cervix was. The uterus is what houses your baby. It's your baby's first home. It is what causes the contractions, or what contracts to gradually put pressure on the cervix and to help baby change position, and to ultimately give baby that power and that energy to be born. In early labour, when it's gently contracting, it can kind of gently prepare baby. It's getting them used to the work ahead. It's gently kind of squeezing baby. It can help to shift and change position, and help sort of put pressure on that uterus. What we want to think about with the uterus is it is building. So it's releasing the cervix, and in the next slide I'll show you a video of more what I mean. But each contraction is pulling that cervix away from baby's head, but also pushing baby down onto the cervix. And the aim is to be that there is no more cervix left, and instead there's a big strong band of muscle at the top of that uterus in order to help birth baby and push baby down. So yes, as you're contracting, as you're going through labor, your cervix is opening. But we want to think, rather than this disappearing, we want to think about this power, this potential, this building of energy at the top in order to birth and push baby. Perfectly designed to kind of gradually happen as you and baby are kind of working together. So just take a look at this video. It shows a bit of a model of a baby. It's a very small baby. It's a ping pong ball inside a balloon. And you can see here in this picture, you've got the uterus as the main part of the balloon. That is filled with air, but in real life, it's filled with baby, it's filled with water, it's filled with placenta. And then you can see at the bottom bit of that balloon, that's quite a long cervix. And at the beginning of the video, it will show you the sort of Braxton Hicks contractions that you can sometimes have as in pregnancy and in the early sort of part of your labour. And they're practice contractions. They're kind of squeezing, they're not making any changes to the cervix. And the difference between the Braxton Hicks and the main contractions is that it is pulling that cervix back over baby's head. So you can see what it does. So I will just give it a play. So you can see these Braxton Hicks contractions here. They're just squeezing, they're just activating that uterus, but not really doing a lot. And these are the main contractions. They're pulling back over baby's head. This demonstration shows quite long contractions, and not many. In reality, you will have many, many more shorter contractions. But you can see how that's really taken effect on that cervix. It's really changed that cervix. Baby is moving down, baby is taking their time, and gently sort of stretching things open as they prepare to be born. Your baby won't come out that fast. There's no way of controlling how fast that ping pong ball flew out of that balloon. But reality is it won't be going that quickly. So how does that cervix contract? How does it work? Hormones are the most important thing that is required, and it's designed to, so oxytocin is the hormone that causes contractions in your body, and it's designed to gradually build in. I've got another webinar that's talking more about sort of mindset and how you can deal with birth, and we'll talk more about how you can boost your oxytocin, but without oxytocin, or sometimes a medical form of oxytocin, your contractions just won't happen. You need to fuel your uterus. Your uterus is a muscle. So you can see in that picture of the uterus up the top there, it's not actually a picture of the uterus, but it's a picture that's designed to represent the uterus. It's a muscle. And you've got lots and lots of muscle fibers within that uterus. You've got horizontal muscle fibers that are pulling the, you've got vertical muscle fibers that are pulling that cervix away from baby's head. And you've got the horizontal muscle fibers that are all built in to build that strong power to ultimately push baby down. And they're all interwoven together. And you need to really fuel that muscle in order for it to work efficiently, to allow those muscle fibers to move past each other. So oxygen is the number one thing that you need to fuel that uterus, but hydration, energy, giving that muscle what it needs to work, and allowing space. You need to physically allow space for that uterus to expand, to to help kind of maneuver baby into different positions. If you've got restrictions, if you've got tensions, if you've got tightnesses, if you've got restrictions in your pelvis, restrictions within your stomach and your sort of stomach muscles and your hips and everywhere, your uterus is going to have quite a difficult job in order for it to expand fully and do its job as it needs to do. So preparing for birth really is a pregnancy project. It's not something that you can kind of just walk and do for the most part, because modern day life doesn't really work in favor of our bodies. You know, we're constantly putting pressure on our bodies that really shouldn't be there, but we all do it. So the early part of your labor, as I've said many times, it's the longest part of your labor. There's a huge variation as to how long this could be. It could be 6 hours, it could be 2 to 3 days. It can be really quite start-stop, which is why medically it's not classed as labor until you're in active labor, until you're sort of 4 or 5 centimeters dilated. But humanly, you very much are having or experiencing labor in this first stage, in this early part of your labor. It can be as short as an hour or less. It's really, really individual to you, to each baby as well. Common sort of signs that you might be experiencing early labor is backache, cramps, kind of period type aches, cramps, pains, stop-start contractions. You know, a lot of clients experience periods of sort of regular contractions of their uterus, and then they disappear. So it's usually in an evening, having a period of contractions, going to bed, waking up the next morning, going about their day, absolutely fine, gets to the evening, having more contractions again. It can be, you know, however you experience early labor, it can be really tiring and frustrating sometimes when it's this start-stop. But it can also be really exciting, really easy to kind of forget how important it is that you need to rest, you need to relax, and think about this part of your journey being about your body helping you to prepare, helping you to kind of line things up, helping baby get in a good position, helping that cervix to be nice and soft and short and ready to open, and really kind of giving baby a gentle introduction to the journey ahead. So as tiring and as frustrating it is for you, it is all done with a purpose. And it's our job to kind of rest, relax, encourage gently with sort of your positioning, mindful movement, understanding what is happening, and taking that pressure off yourself and baby. You know, not having yourself on this timeline, and just really allowing things to develop as they need to and as they will do. So early labor or pre-labor, you'll have an increase in Braxton Hicks. This might be in the days, it might be in the weeks leading up to birth, and it's all focusing on changing that cervix. Those period type aches, those cramps, those pains, those tightenings, those loss of your mucus plug. So your cervix is never fully closed. There is mucus up there, literally plugging the gap just to make sure that nothing can kind of get in, no infections to get in, and nothing can kind of leak out. And as that cervix is moving and changing and adapting, that mucus plugs gets loosened and then it can be released. Your mindset, as I've written here, but I've spoken about just now in the previous slide, remembering that everything is progress, everything is moving along, your body is working as it should do. Most of the time, it is working perfectly fine. There will be times when things might feel a little bit off. They might be more painful than they would be in another person, and that's usually a sign of some sort of imbalance, some sort of restriction. There's loads of things that you can do to help move those things along. And then, of course, there may be medical scenarios that crop up, and that is what the medical world, midwives, doctors are there for. But most people are able to do this absolutely on their own. So signs of kind of moving more into early labour, your contractions are starting to build. They're usually increasing gradually from sort of slightly uncomfortable to really fully taking your concentration and attention. I always kind of describe early labour contractions as being a bit of a headache sort of rumbling in the background. You can still have conversation. You can still go about your day. It's not really interfering. As your contractions are building, as you work through early labour, they take more of your attention. So suddenly, you know, with a headache, it might be you get sudden stabbing sort of pain, and that kind of stops you in conversation, but then you can kind of pick it back up again straight away. Again, as your contractions build, you'll be increasingly moving towards struggling to kind of come out back into the real world. So those contractions will really take you in. You really have to work and to focus through it. And then you come out and take a little bit of time to wonder where you were, what you were just saying, what was just happening. And so the focus on early labour is to kind of move more into your own world, your own bubble. So your mindset in this bit of early labour is really trying to ignore the sensations for as long as you possibly can. Be mindful of positioning and hydration and oxygen and, you know, fueling your uterus. But until you can't get through a contraction without some sort of help, either with breathing, with movement, with relaxation, you want to try and ignore them for as long as possible, because it can take a really long time. So you're moving more through into active labour. Sometimes it's called established labour, or it might just be labour. What is happening here? Your cervix has opened enough that it is 5 to 10 centimetres dilated. It's just worth quickly going back to early labour. A lot of the early part of the journey is focusing mainly on changing that cervix. So softening, shortening, moving it forward. And it's not until you're kind of often getting those regular contractions that are building and increasing that actually your cervix then starts to open. Everything else will continue. It will continue to move, it will continue to soften, it will continue to shorten, but that tends to be the start of the journey, is the shortening, the changing of that cervix. And then once it's soft enough, it can then start to open. And your active labour is then when your uterus continues to open. Most of the stuff has been done. Baby is moving through the pelvis. Your cervix is releasing over baby's head. Your uterus is building that power for that second stage of labour. So your contractions are more consistent. They're coming, really quite regularly. They're building in length, they're building in strength, they're building in power. There can sometimes be a periods of pause. Can be quite normal. You know, it might be designed to just give baby a bit of a rest, potentially give you a bit of a rest. Can sometimes be as a result of you maybe not resting enough. It might be a result of you needing to rehydrate, refuel. It might be a sign that you need to go to the toilet. Your pelvis and where your bladder is placed within your pelvis can actually get in the way of baby moving down into that pelvis. So sometimes going to the toilet can really help to make that space in order to, again, put more pressure of baby onto that cervix. So your contractions will be kind of lasting up to about 90 seconds long at this point and coming more frequently with periods of rest. Excuse me. When we're thinking about when to call the hospital, when to call your midwife, that's a whole other separate conversation that you can have. But on the surface of it, you're looking for sort of 5 contractions in a 10-minute period of time. You're looking for 3 contractions in a 10-minute period of time. Each contraction is lasting about a minute, and they are coming frequently. If it's your first time, this has been happening for about an hour. They're taking all of your concentration and attention. You need to use different techniques to help keep you calm and relaxed. So breathing is my top tip. But movement, regular sort of rotation, swaying, movement, getting your birth partner involved. There's so much that you can do. As I've said down here, positioning, movement, understanding what is happening is massive. And then you've got transition. Once your cervix is really almost ready to release baby, you'll move into something called transition. Now, this is, again, very individual as to kind of when this happens and if people experience it. It can be a phase of your labour from, let's say 7 to 10 centimetres dilated, or it can just be a brief moment. Its signs are your typical film, television reaction. So signs that you're maybe struggling to cope, wanting it to stop, dramatically screaming that you want an epidural, saying that you hate your birth partner, those sorts of, that kind of dramatic TV sort of reaction doesn't usually happen and would be a sign that there is a lot of adrenaline pumping around your body, and you, your birth partner, your midwife should be really working on trying to lower that adrenaline, because there's panic, there's something going on. Your contractions will feel much harder at this point because you've got some adrenaline coming into your body to give you a kick of energy to birth your baby, and just a kick of awareness to be able to look after your baby. So there is adrenaline that's going to be floating around, and that is why suddenly these contractions might feel harder. But hopefully you won't suddenly be screaming for an epidural if you've been coping really well up to that point. You may well have an extreme reaction, but hopefully we've been keeping sort of a lid on the adrenaline, and we've been supporting you to be as calm and relaxed as possible. Birth partners, this is where you can really come in, and the midwives will be upping their support at this point, but also getting quite busy and excited, ready to sort of meet baby. So the second stage of your labour, this would be the pushing stage, and usually lasts between sort of 1 and 2 hours. It's usually a bit longer, or towards the longer part, for a first baby, and then it tends to be shorter for any subsequent babies that you might have. Thinking about positioning, space, really understanding your pelvis is really important. We focus a lot on your body and how your body works, and your pelvis and all of your muscles, and how you can make more space in our antenatal course. Think about relaxation, allowing your uterus and your body to do its job by relaxing everything that you can possibly relax. Pumping oxygen in, so continuing to breathe, bearing the environment in mind, how sort of science works with our environment to help lower adrenaline, to help boost oxytocin. And time, giving yourself time, allowing yourself that time is really, really important. So then your third stage, this happens after baby is born, and then it finishes once that placenta has been fully delivered. It allows, as I said right at the beginning of this presentation, baby to transition from being fully supplied with everything that it needs via that umbilical cord and that placenta, to having to breathe on their own, to having to do things automatically within their body. They have to learn it. And yeah, there is just so much to consider for this third stage of labour. So it's important to know, we won't be going into this today, there are just like actually I didn't spend very much time thinking about the third stage of labour. There is a lot to cover. But it's important to know that interventions can be offered, can be needed at any point during those 3 phases of your labour. Things like induction, augmentation. So by augmentations, I mean helping your contractions to come. So that might be breaking your waters, that might be introducing an artificial oxytocin hormone. C-sections, instrumental deliveries, helping with the delivery of your placenta. There is so much that may be offered / required medically for your labour, but often there are other ways to move things along. We just need to know about them. And again, as I said right at the beginning, it's about knowing what your choices are. So you know that if you choose an induction, it might put you at a higher risk of an instrumental delivery or a cesarean. But knowing that that might do, you can then put things in place to try and help yourself avoid them. Just because things are more likely statistically doesn't mean there's nothing that you can do to avoid it. There is always options, there are always ways. So the things that you do during your pregnancy, your positioning, how you hold yourself, releasing muscles to make space, making baby's job easier, learning and practicing techniques that really do help, decision making, so you really know what you want from labour, and if this happens, this is what I want to happen. Making those choices in pregnancy can really positively impact your birth. You just won't know it until it's done. And you may well not even know how your decisions, how your preparations have impacted your birth, but they really, really can. And now more than ever, we need to take our bodies, our health, and our babies starting to life into our own hands. Intervention rates, cesarean rates, induction rates, they're all on the rise. If they are on the rise because we are fully informed and we've made those choices, it's fine. But I suspect that a lot of these things are happening because we don't understand what the impacts are and what the implications are, and we're just kind of heading into it blindly. We just need to prepare. We can't control anything that's going to happen, but we can really prepare for it. And that's why antenatal education is so important. So I just want to give you a bit of a roundup of me, about what I do. Just read some of my testimonials that kind of come through. So I loved attending Jilly's active antenatal classes. They give me a fantastic chance to relax and to spend time with Bump, while also giving me the confidence and the right frame of mind to deal with labour. I got practical tips, which I put to good use in labour. Jilly was brilliant. I highly recommend it. Another one, Active Antenatal has provided me with a fantastic toolkit for my pregnancy and labour. Jilly's gentle, friendly and warming approach made each session truly rejuvenating and something I'd look forward to attending every week. I learned so much about the birthing process and exactly what to expect during and after labour, as well as learning different breathing techniques, which massively helped me through my labour. I felt relaxed and prepared for the birth of my son, and this was all due to these classes. Would highly recommend. I attended active antenatal classes, which really helped me through pregnancy and labour. Jilly creates a warm and calm environment. I left each class feeling relaxed and excited. The class has the right combination of education and relaxation. It was also nice to meet other pregnant ladies to discuss our experiences. So I run pregnancy yoga classes, and I also run 2 antenatal courses, one for first-time expecting parents and then a refresher antenatal course for people who are expecting their second, their third, any number after 1. Because your experiences are really different. Pregnancy yoga is a space for everybody to come together, to share their pregnancy, to share their journeys, to create that community, to ask those questions. But those antenatal courses, so they cover full hypnobirthing techniques, are there to really educate you. So the CubCare antenatal course and the refresher course covers a lot of the similar things, is the most comprehensive antenatal course that you will find, particularly for those in Welwyn Hatfield, where I do my where I do my live courses. I do have an online course as well. It's a unique 22-hour format, and it covers everything you need to know about birth, about being confident, about caring for your baby in the early days. So you'll have a full hypnobirthing course. We'll learn breathing, movement, relaxation techniques for birth, and why that is so helpful and so important. We'll think about active birth and body mechanics. We'll really get into the science of why certain moves, certain positions are really helpful for different muscle groups and for different aspects of birth. And we will assist them so that you can do it regularly during pregnancy to have the biggest impact. We'll have full education on medical births, but we'll really talk about how we can deal with it, how we can empower ourselves, and the impacts that might have. We'll have 14 hours for you to prepare with you and your birth partner. And then we'll have 8 hours of movement and relaxation practice just for the pregnant person. This is really unique, but it's really essential for birth. You need to practice. And I know, I do it, that if you're given a set of things to go away and practice, it really rarely becomes a regular activity that you're going to do. You might know the benefits, but it's really easy to make those excuses. So having that dedicated 8 hours, those 4 weekly sessions just for you to go through these moves to practice it, you'll be more likely to be able to maintain it. And they're really simple things that you can do, helping you to understand all about feeding and caring for your baby. We'll talk about breastfeeding and how that works. We'll talk about formula feeding and how that works. We'll talk about combination feeding and how that works. We'll talk about sleep, caring for your baby, safety, all of those really, really important things. And you'll have a chance to practice changing nappies, putting clothes on baby, etc. Another unique thing about this course is that we will focus a lot on baby wearing. Obviously, I'm a baby wearing consultant, so I know my stuff. It's really helpful practically for you. It's helpful so much for baby in those early days. It can really enhance bonding and make that easier. And we'll also talk about baby's brain development and helping and playing with baby and learning to kind of live with baby. Plus, everyone who attends an antenatal course with me will have a one-to-one coaching call with me, so that we can really get into your personal circumstances and really help to make a plan for your that is invaluable. It's me for everyone. I'm not a medical professional. I'm not your midwife. And I won't be sort of answering any medical questions like that. I would always refer you to your care providers. But it can be really helpful to have somebody in the know that can really help you make decisions and kind of plan what you want. And everyone will also get a one-to-one baby wearing consultation as well to really help you to feel confident about carrying your baby and learning what carrier might suit you. I always think of carriers being a bit like a pair of jeans. They don't suit everybody and not all ones work well for everyone. So that is me. And we can see here with the refresher course, it's a shortened version. You still get all the information and education you need, but you have 3 hours to prepare and sort of refresh on baby. We don't need to spend a long time changing nappies or learning how to dress baby. That will come back to you. You will have done hundreds and hundreds and hundreds of nappy changes and clothes changes in your time. It's more of a recap and a learning about how you can cope with more than one child, how you can help your older child or children to adapt, all of that sort of preparation. And we've still got that 8 hours of movement and relaxation for the pregnant person, and that real education on why that is so important and things you can do. So that is me. Just going to stop the share. I hope that you have found that useful, and I hope that you will use that as a good start for your antenatal education. Thanks for spending some time with me today, and see you soon.